Hello. On behalf of the Spina Bifida Association staff, welcome to the Spina Bifida Association's Ask the Expert session, Adult Health and Aging Well with Spina Bifida. My name is Judy Thibodeau, a member of SBA staff, and I and my colleague, Juanita Panliner, will be with you for tonight's question and answer session. Tonight, our panelists will provide their responses to the questions asked when participants registered for the session. If there is additional time, the panelists will respond to questions that you submit using the Q&A feature found at the bottom of your screen. Before we begin, a few housekeeping notes. If you have a question or comment, please feel free to use the Q&A feature at any time, and we will try to get to as many questions as possible. You may also use the chat function, which we won't monitor as closely. You will receive the recording of this presentation and an evaluation survey. Please take a minute to complete the survey so that we will learn what topics are important to you for sessions like this in the future. Lastly, today's event is being recorded and we will post the video to our website soon. Our panelists for tonight's session are Dr. Tim Brei and Dr. Brad Dicianno, SBA's medical directors. Welcome to Tim and Brad.
Thank you so much, Judy. And it's a pleasure to be with everybody tonight. And we really appreciate a lot of the thoughtful questions that we received in advance. So we do want to share with you some QR codes as we go through the presentations tonight. We will offer some resources. So we may refer to some of the resources that you can access online. So this in particular is a playlist on YouTube that has a lot of information related to getting older with spina bifida. So with that, I think we can go ahead and jump right into the medical questions. And just as a backdrop, I am the medical director of the adult spina bifida clinic at the University of Pittsburgh. So my practice involves taking care of lots of adults, age around 18, all the way up to my oldest has been 90. So I see patients of a wide range of ages. So I hope that I can provide some insight to some of these questions. And my specialty is physical medicine and rehabilitation. So I'm a rehabilitation doctor.
And I am a developmental pediatrician by training, so I have not taken care of adults specifically, though I am an adult with spina bifida, so my role is going to be at least giving you some information from my own personal lived experience, and then some things that we hear from others that come into the National Resource Center for the Spina Bifida Association and some of the lived experiences of those people.
So one of the first questions we get, and this is one that we get a lot, is do individuals with spina bifida age more quickly than people without spina bifida? What are your thoughts on that, Tim?
I don't know that we age more quickly in terms of body systems in general, or aging systems in general. But I do think that some aspects of having spina bifida are more likely to give us issues earlier than other people. So for example, weight management and obesity are very common problems that people with spina bifida face, and often face them at younger ages than I think the general population. And so with that comes secondary issues like heart disease or high blood pressure or other kinds of things like that, which may be of earlier onset, though there are other contributing factors to that, such as family history. With my own personal experience, I have been able to walk most of my life. But now that I am in my 60s, although I still have the ability to walk with crutches, I have found it to be a little more difficult because my muscle strength is a little bit different than it was when I was 50. And some things such as balance, I think, have affected me more than they perhaps do other people at an earlier age. But in terms of the systems that cause us to age or what we know about aging, and the genetics of that, I'm not sure that we know that individuals age more quickly. But if you have a mobility issue, it may mean that you are less likely to be ambulatory for as long as other people your age are.
Yeah, I think those are great points. I hear from a lot of patients that they perceive themselves as perhaps aging more quickly than their peers, who don't have spina bifida. But what I also point out is that spina bifida isn't a progressive condition in and of itself, like multiple sclerosis, for example. So we know with some conditions that are progressive, like MS, the neurologic condition itself advances as you age. Spina bifida is not one of those conditions. It's the injury to the spinal cord and the congenital effects of how the brain develops and the spinal cord develop. That's all that all happens, as you're forming as a fetus, and it doesn't continue to progress as you get older. Certainly, like Tim said, you can have cumulative effects of problems over your life that, cause mobility problems and cause, pain. And we'll get into some of those in a little bit more detail tonight. The second question, I think, is a bit too difficult to answer specifically, because this is asking about a patient's own personal situation. So we're not able to answer questions about a particular patient's case without, being the physician for that person. So the question about whether, your symptoms will get better with a surgical procedure in urology is really best addressed by asking your medical team. Certainly, there are surgical procedures that try to improve symptoms of bladder continence, but we don't have enough information to answer this particular question. The next question is about whether we see different practices in urology depending on age. So, do we change our techniques of how we treat people from a urologic perspective over a person's lifetime? What are your experiences with that, Tim?
Um, so I thought about this question in a couple of different ways. My own personal experience is that I don't think that the practices or procedures that we have change over the lifetime. Um, um, However, I do think that with aging, that we don't necessarily expect that what worked for you at age 20 is going to work for you at age 40. There can be lots of different contributing factors to that. Whether or not you've had a bladder augmentation, whether or not how you manage your bowels, etc. Certainly, as we get older, there are medications that sometimes that we have to be on for medical conditions that we develop as we get older that can affect what happens with whether or not they can cause diarrhea or constipation as side effects of those medications. So I will tell you that mine have changed. I won't say significantly, but I certainly have to do different kinds of routines now for bowel and urologic management that I did not have to do, for example, 10 years ago.
Yeah, and I think, bodies change as we get older too. So, in older folks, regardless of whether you have spina bifida or not, women tend to have problems with uterine prolapse, that can occur later on in life, stress incontinence because of weaker pelvic muscles. Men can develop issues with their prostate, so enlargement of the prostate. So sometimes we see the techniques and treatments that we're using for older folks with spina bifida being a result of the way that their body's changing because they're aging. And again, it's not the spina bifida that's aging, it's just that you're an older person and your body's going to change as you go through life. And sometimes that does affect your bowel and bladder function. The next question is about ways to maintain kidney health without drugs. And the couple of things that came to my mind when I read this are, good nutrition and enough fluid intake. Those are two things that really do relate to kidney health, as well as just having proper kidney screenings. In our healthcare guidelines, one of the recommendations is that we check an adult's kidneys once a year to make sure that they're functioning properly. And sometimes we can catch problems early enough that it helps us maintain kidney health over a person's lifetime rather than waiting until the kidneys are having a lot of issues later down the road. And so we really recommend that patients come in for their annual visits to make sure that we can check kidney function. Do you have other thoughts on that one, Tim?
Just a personal experience, because I've had a bladder augmentation for many, many years. And I've always been fairly religious about following up with the urologist because that has been one of the major effects of spina bifida that has impacted me personally. And I see a urologist now, although my bladder management has not changed significantly and my kidney ultrasounds are normal. The blood work is indicating now in my mid-60s that a kind of rough measure of kidney function that's based on what's called a complete metabolic panel may be decreasing slightly. And so my urologist is already made a referral to me to be followed by a nephrologist so that we can monitor this. And that was not necessary for me earlier. So I think, again, this may be a product of me aging. So.
And what about catheters? This person, although we can't answer this about this person's personal situation, but I think we can generalize this question as to whether it's okay to use catheters throughout your lifetime for a long period of time. This person's been using a catheter for, let's say, over 20 years.
I would say that actually intermittent catheterization has actually been a mainstay of treatment that has been able to help preserve and prolong life and optimum kidney health and bladder health. There can be some complications of using a catheter long term. And it depends a little bit whether you have a surgical procedure that allows you to catheterize through that or whether you catheterize through your urethra. I have not had a surgical procedure to give me a catheterizable channel. So even though I've had a bladder augmentation, mine was done early enough before they ever really did this surgical procedure for a catheterizable channel. And so for me, one of the things that my urologist monitors is that I do have some scarring in the urethra that sometimes makes it difficult to catheterize. And I think that that's just a product of my over I guess approximately 40 years of catheterizing. So some of those things I think come from that.
Another was pointed out that, possibly an interpretation of this question might be that the person could be using the same catheter for all of those years, not catheterizing in general. And, I think it's important to point out that, we do have disposable, non-reusable catheters now. Although some people do have trouble with insurance in some cases, it is really important to talk to your medical team to see if you should be disposing your catheters and using new ones and whether your insurance will cover that. I do think it's also important to talk about what type of catheter that you're using, because if you've been using the same catheter style your whole life, realize that catheter technology changes. There are lubricated catheters, closed systems. There's newer catheters out now. There's smaller ones that are easier to transport and put in your backpack or purse. So it might be important to talk to your medical team to see if there's newer types of catheters out there that might benefit you. And then we have a list of conditions that people have questions about related to how the management might change as the person gets older. And I think the answer to some of these questions might be that, we treat them the same in people with spina bifida as we do in people without spina bifida. Things like autoimmune disease, for example, which aren't necessarily directly connected to spina bifida. Do you have thoughts on some of the others, Tim, in terms of your experience?
So I think that for the questions about the Chiari, hydrocephalus, and shunts in adults, it frankly in the United States has been a bit of a tough nut to crack to get that ongoing maintenance. So I think you being aware of what the symptoms of shunt malfunction are, and symptoms of Chiari malformation are, and then working with your primary care doctor, or hopefully in many cases a physical medicine and rehabilitation doctor that understands these issues. Sometimes in the United States, we have a specialty called med-peds physicians who are trained both in pediatric conditions as well as adult conditions, who know how to sometimes bridge these gaps from a primary care standpoint. But I do feel for you that these are often difficult, and the onus currently is really on adults to know what the symptoms are and what their baseline is for these things so that they can begin to seek treatment and get the right referrals. Seizures and their frequency, again, I think is difficult. Certainly adult neurologists manage seizures as well. My own personal belief is that I don't know that seizures necessarily change in their frequency from pediatric to adult, though Brad may know something from his population. But certainly seizures or an increase in frequency can signal a subtle shunt malfunction that might not be giving other symptoms. Most neurologists should be thinking of that if people have shunts, but it certainly is important to know. Orthopedic issues, from my standpoint, again, are often in adulthood really handled by physical medicine and rehabilitation specialists who understand orthopedic issues in general in spinal cord injury and spina bifida. But again, you might need consultation with an orthopedic specialist if you're developing arthritis or if you're developing other conditions that affect other adults. But again, a good physical medicine rehabilitation physician can often really help figure out what is due to what. Diabetes, again, I don't think the treatment for pediatrics is any different than it is excuse me, is any different in adults with spina bifida versus adults without spina bifida. However, I do think it's important that they really work with their primary, if you have diabetes as an adult, it's really important that you work with your primary care provider and really manage your diabetes as well as you can, because certainly people with diabetes who don't have spina bifida can develop skin wounds or difficulty with healing wounds. And that compounded with having spina bifida, I think is potentially a real challenge. So the more you can really manage this at very young ages and work on it, I think is really important. And I don't know, Brad, if you have anything else on that.
Yeah, I think with regard to orthopedics specifically, it's important to point out that in the adult world, surgeons in this specialty are oftentimes very specific to certain parts of your body, which differs a lot from pediatrics. A lot of people have the experience of going to a pediatric clinic and there's one orthopedic surgeon, and that orthopedic surgeon can, handle issues with the hip or the foot or ankle or even the spine sometimes. But in the adult world, that's pretty rare. And a lot of the specialists that you'll see are very subspecialized. So for us, for example, we would have a different orthopedic surgeon for spine versus a different one for hip and knee versus a different one for foot and ankle. And there's even ones that specialize just in the upper limb when you have, hand, wrist, or shoulder problems. So I think part of this question also is about understanding the types of providers in the adult world and getting to those providers. So one way to do that is make sure that you're going in for your regular checkups and you're having someone doing those screenings for the neurologic symptoms, the orthopedic symptoms, and who can get you to the right kind of provider, because that person may not be in the spina bifida clinic or the clinic that you're going to. Another question on the list is about menopause. So sometimes women with spina bifida note more difficult symptoms with menopause. And there's a question of whether it may have early onset. I don't know whether there's any research data to support this, but I do know that, puberty can be early onset in girls with spina bifida. And so the whole axis of hormones can be shifted over a person's life. So things can happen earlier, including menopause. I don't know that we've had any research to look at the average age of menopause in women with spina bifida, but I would say from my experience, we do have patients who describe experiencing symptoms earlier. Do you have any thoughts on that, Tim?
I do not.
Another question that we have is about dementia. And we've had this question before about whether it's more common in people with spina bifida and specifically hydrocephalus and spina bifida. I know, Tim, you've thought about this a bit.
So again, I think for people with spina bifida who have obstructive hydrocephalus and have required a shunt from early age, I don't think we know the answer for sure, but certainly there's an adult onset form of hydrocephalus that, as far as we know, is relatively rare, and that people with spina bifida, I'm not aware of any reports of people having it. And that's called normal pressure hydrocephalus. But that's usually adult onset, very rare. And I think dementia is common there, but I don't think we have that information or feel that people with hydrocephalus and spina bifida necessarily have dementia early. I think it's important to be aware that memory issues can happen in spina bifida separate from dementia as part of the learning profile. But again, in adult primary care, screening for dementia is something that often happens in a primary care physician's office as part of their annual visits.
And there are some types of, memory problems that are progressive that are hereditary. And in talking with our neuropsychologist, he said one thing to remember about that is those types are more related to age, rather than, having hydrocephalus. We all, no matter whether we have spina bifida or not, have an increased risk of memory problems as we get older, as our age goes up. And that's not necessarily a spina bifida related thing. Um, but also that there are vascular risk factors, for memory loss. So, he was also pointing out to me that we need to be mindful of our health. So, eating a heart healthy diet, exercising, and not smoking are ways that we can keep our blood vessels healthy. And healthy blood vessels can help prevent, problems with memory down the road. So those are just some other factors that might be more strongly correlated with memory problems than, having spina bifida itself. But I think we can go to the next slide. And we also have a lot of questions related to bowel management. So we did put a QR code up here for a lot of resources that we have on bowels. And then one question that we have here is, bowel management with aging, or also bladder management, which I think we've touched on a little bit already. But Tim, what are your thoughts on aging with bowel?
Again, for both bladder and bowel, I think for me personally, the changes that I have had personally relate more to bowel management than they do bladder management. My day-to-day bladder management really hasn't changed much, but as I've gotten older and needed to start on medications for blood pressure, that changed some issues with bowel. Certain things might change at least for a period of time. So, for example, one of the side effects of getting an infection like COVID is diarrhea. And while that may resolve quickly, there may be times when that doesn't resolve as quickly. So I think there are a number of medicine things that can contribute to constipation and or diarrhea that in my day-to-day have been more impactful than what I do for bladder management.
Yeah, and I've also.
Go ahead, Brad.
I'm sorry, Tim.
The other thing I was going to say is I am now of an age which is challenging because it is recommended that people over the age of 50 be screened for colon cancer. And there are now a few ways that you can do that, which may be screening tests. But if you really require a colonoscopy where they sedate you and put a scope into your colon to look specifically, I know of no easy way to manage that. And yet it is a recommendation that people with spina bifida have that screening.
Yeah, I think working with a GI physician who has experience in understanding bowel prep and the difficulties a person can have with doing a cleaning before the colonoscopy is really important. It's not necessarily always easy to find a physician who's willing to work with you on that bowel prep and understand the consequences of it. And I think also, just as our bladders change when our bodies themselves change, so can the bowels. And so some things that we see as people age and people's bodies changing is hemorrhoids. That can also be a problem. And also rectal prolapse. So sometimes you can, have more problems with constipation just because there's physical blockages there. from the prolapse or from hemorrhoids that are making it more difficult to move your bowels. So just a couple other considerations. And I think we can go to the next slide. And this slide in particular focuses on research. So we wanted to point you to our community-centered research agenda. And for those of you who don't know what this is, basically when we were writing the healthcare guidelines, we found a lot of gaps, more than 250 to be exact. And we realized that there were a lot of areas where research needed to be done. And we asked our community to help us prioritize what was important for the next generations of researchers to start working on. And so you can read about that and what the agenda looks like by going to that QR code. And so the first question here is, what research is being done to help women with recurring pelvic prolapse issues, which relates to some of the questions that we had before. I do know that there have been some papers published on just characterizing prolapse, recognizing that it is a problem in women specifically who have spina bifida, and also some research that shows that it happens sometimes in younger women with spina bifida compared to women in the general population. I don't know necessarily, though, that there's any research specifically on, different types of interventions that might be appropriate for women. Tim, I'm not sure if you're aware of anything else in that area.
I am not.
And then as far as, so the latest advances in assistive technology or medical devices, some things that I wanted to point out. So, we talk about pressure ulcers being a big problem in our population. So there are, new technologies that are being worked on to provide pressure relief, both as wheelchair cushions, new cushion technologies, new bed mattress technologies. So that's exciting. There's always, new advances in wound care as well as new advances in surgical techniques for wounds that are severe for pressure ulcers. There are advances in artificial intelligence that are being used to educate people, and not only, the community of people with different medical conditions, but also providers. There are mobile apps out there that help people, manage their medical conditions better. I'm also seeing some interesting advances in transportation, particularly electric vehicles. One thing that people don't realize about electric vehicles is that the way that they're designed is that the batteries are in the chassis or the bottom part of the vehicle, and that limits the size of the back of the vehicle that you would use to load a wheelchair. So as we advance to more electric vehicles, there may be some more problems with getting wheelchairs into vehicles. So there's a lot of research going on now in how we can improve wheelchair transportation and electric vehicles, and also wheelchair transportation safety for travel in other domains like airplanes. So those are some of the areas that I'm excited about. I know that there's probably others too. What are your thoughts on that, Tim?
So I know less about that than you do. I think the things that we are learning, though, about the issue of quality of life, that's part of how the community-centered research agenda came about, because things that relate to mental health, for example, have, I think, a very big impact on people with spina bifida. I also think that things such as opportunities for socialization, opportunities for work, there are many kinds of factors that can impact an individual's quality of life, but some of those items really are really came to the forefront because they were highly mentioned from the community-centered research agenda. So what is quality of life for me may be different than what is quality of life for you, and what affects my quality of life might be different than it is for you. But I think mental health, bowel management, um, um, kind of promoting self-management, those are all things that I think potentially impact quality of life for the people with spina bifida. Many of those also impact people without spina bifida, but but um, so I think those are important. But you're the expert in medical devices and assistive technology.
We could probably have a whole session just on that. Well, I think we can move on to exercise and weight management. So one of the questions here, it's a difficult question about regaining muscle tone and being able to walk again. And I do occasionally get this question from my patients who haven't walked in a long time and then later in life think about whether they may want to try to walk again. And that's a difficult question. It's very person specific, but here are some things that I would say are important to think about. One is safety. You know, if you haven't bared weight on your legs in a long period of time, uh, in order to be able to do so, you know, we have to make sure that you don't have a risk of fracture. Some people have osteoporosis and would be prone to fracturing their bones if they were to stand upright again. And some people have weakness of the muscles and even contractures of the joints where the joints have gotten tight, and it may not be possible for that person to be able to stand on those lower limbs. Sometimes muscle tone can be strengthened. You can get your muscle strength back sometimes if that muscle still has what we call innervation or nerve supply from the spine. So if there was strength there at one time and you lost it because you just haven't used it in a while, sometimes it is possible to strengthen those muscles again. But it's not often possible to strengthen a muscle that never had strength in it. So sometimes our muscles don't have good nerve supply from the spine, and those are muscles that are really hard to strengthen because you need that nerve supply from the spine in order to develop strength in those muscles. So this is a very individualized thing. If you have interest in being more physically active, you know, there's a lot of ways to do that. Some people may be able to walk, but others may not. And for those who are not able to walk again, some options might be simply standing or other types of adaptive exercise, you know, that don't necessarily involve walking or standing. There's lots of options out there. It's just really important to, I think, talk with somebody who is skilled in designing an exercise program for you. We also have a lot of resources on exercise and weight management. So that's the QR code here on the screen that will take you to some of those recommendations, including some potential exercises for people with spina bifida. And some other things that we should talk about are just, you know, metabolism and weight management becoming more difficult for a lot of people as they age. What are your thoughts on that, Sam?
I think that is some of issue of weight gain is genetic, but some of it is, again, I agree that if we're not very mobile, it's easy to gain weight because it's important to exercise, and different forms of exercise can be important. So, strength training can be important, aerobic training can be important, stretching, adapted yoga can be important. So I think there are lots of things, but I would also suggest that working with your primary care physician in terms of getting a nutrition consult so that you're working at eating as healthy of foods as possible, but also potentially cutting back on your caloric intake unless you're really vigorously exercising is something to do. And I think that's often a partnership with primary care and a nutritionist to really be involved with that.
And the physical activity guidelines, I'd just like to point out, are specific about how much exercise you should be getting just to maintain good health. So the guidelines actually recommend 150 minutes of exercise a week if your exercise is moderate. So if you're doing moderate level exercise, that comes out to 2 hours and 30 minutes a week. So we find that a lot of people are not, getting that level of exercise in order to maintain health. If you're exercising at a higher intensity, which we consider vigorous, so that's really, really high level of exercise, then the recommendation is 75 minutes a week, which is an hour and 15 minutes. But I think it's important to just, also remember to avoid being inactive. That's the most important thing. If you're inactive, that's where you see a lot of these problems with metabolism, with weight, and some of the secondary conditions creep up. All right, I think we can go to the next slide. And here are some additional resources on physical activity and weight management. And we'll move on to maintaining independence.
The National Center on Health, Physical Activity, and Disability, this particular QR code is a national center in the United States, which is focused on improving health for people with disabilities. And so they have a number of resources on their website that you can access.
And Tim, what are your thoughts on how somebody who wants to be as independent as possible at older ages can do that? And how can a parent who wants to see their child grow up and be independent as an older adult, what can they do?
Um, so the first question is one that I'm just learning about because, as I said, I have been actively able to walk for most of my life, and now I walk with crutches or use an electric scooter. And some of it to me comes, so I was, physically independent as I have gotten older. Now that my mobility is different, um, to me, it's a little bit of, for me personally, I should say, it's a little bit of a mindset issue. Standing and cooking is now harder for me. So I have to figure out ways to adapt some of those activities that were relatively easy for me to do before. And so some of that to me is a mindset issue of this is now a problem I'm experiencing. So what can I do to address that problem? I do not live in a technically accessible apartment right now. So I don't have lower counters than other people. Um, I have the same stove that's in every apartment in the complex. So I have to figure out ways to do things that allow me to do them, but that I am still safe doing them if I am not able to stand for the period of time that that's happening. And I guess I view that as a new challenge. And some of it comes to just wanting to be as independent as possible and working to maintain as much independence as I can. Um, um, I guess, now I'm old and gray. Um, and um, I've also learned that it's not just about being totally independent, but having at least a community of people that can help you with things at times. So, when I moved into this apartment, I had friends who helped me unpack all the boxes and get my apartment set up. So I think it's relying on the people you know to also help and recognize that for everybody, independence or autonomy changes as they get older. Um, my 80-some-year-old mother is experiencing some of those changes. And so it may be that they're happening at different ages for us, for me personally, because of my mobility changes. But I think some of that is mindset and not being afraid to ask for help for things that are difficult to do. And I don't know what you counsel people about that. I'll answer the other question about the 6-year-old and working to help make them as independent as possible when they are adults in the future. My specialty is developmental pediatrics. So how do children develop? And I think one of the issues about that is if you have a child with spina bifida, it's helping them learn to do things differently, sometimes by trial and error, sometimes by coaching them, but also thinking that there are activities that kids are learning to do at different ages. So at 6 years of age, they're often wanting to learn to be helpful in the kitchen or wanting to learn to do some other things that other 6-year-olds are learning. And I think finding ways to adapt tasks to what your child's physical abilities are, is important. Um, and I think in the pediatric world, lots of people think about this. We often in the clinics get focused on what are the medical issues and making sure that those are managed. But I think clinics in pediatrics are increasingly looking at identifying ways to help promote self-management at different ages, and that it's not just about the medical issues. I think I think issues related to school and learning are very important. Developing skills on age appropriate and developmentally appropriate problem solving. So I think it's helping your child to I don't know that I'm saying this correctly, to be differently abled, to not automatically put limits on them. There may be some things that your child is not physically able to do, but sometimes we have to help them break out of that shell and at least push them to try. So there are whole sessions again in that Spina Bifida has done in the past on this. But I think self-management, the concept of self-management is one of the topics again of the community-centered research agenda. And we certainly have people who are interested in working on that lifespan approach and what are the steps that we can help families take in a very deliberate sort of way to kind of promote that. I'm sorry that's a long-winded answer without a lot of specifics, but
all very important information. The last question on this slide is help for people to come in and help with housework or chores. And this varies by state to state, but I will give you some resources where you can look for these types of services. So the first place that I would turn to is your local Center for Independent Living. So CIL, some people call them CILs, CIL, are organizations across the entire country. So every county in every state has a Center for Independent Living. And they're basically a centralized resource that you should be aware of that you can call and ask for information about a lot of things. So you can ask for information about services, about housing, transportation, all kinds of things. And they will know about the services that are available in your area. Some states offer programs through what we call waiver programs. So there are programs that are like state funded programs that offer services to people of different types. So one is for older adults. So that can be for people who are over 65. Sometimes these waiver programs offer help with housework. And I mention this not only for those of you who are 65, but also for people who might be caring for a parent, an aging parent. So that's important that they may qualify for those services through a state waiver program. The second type of waiver is for people with disabilities. And the third type is for people with intellectual disabilities. So there may be services for waivers in a lot of different areas in that way. Also, there are sometimes nonprofits in certain areas. I've seen nonprofit organizations help not necessarily with house cleaning, but with things like snow removal, shoveling sidewalks or driveways, or also for mowing grass. So those are just some things to think about. And for those of you that have both Medicaid and Medicare combined, sometimes those combined dual programs offer some coverage for some in-home services. So you may want to talk to your case manager at your insurance to see if there is any coverage for that. If there's not, often these services are at low or no cost if for people who qualify. Now, I'll move on to the next section. Oh, before we do that, we do have a QR code here for self-management. And the next slide is on finding healthcare. And we know the number one priority of the community, according to our survey, has been finding providers. So this is an important topic. And I know we're getting close to the hour, so we may want to spend a few more minutes past the hour mark just so that we can get through these important topics. I will start with the first one, which is what training do GPs and medical professionals get on spina bifida? And I would say this really varies. The way that physicians get training is in their medical school, in their residency program, and then also just the experience they have in taking care of these types of patients. And there aren't any specific guidelines on whether certain education programs include educational material about spina bifida. So although we feel strongly that all professionals should be competent to take care of this community, it's not necessarily the case, as you know in your experience, that not everyone gets adequate training. Oftentimes when you do see it in a curriculum, you learn about spina bifida as far as embryology, like how spina bifida causes developmental problems with the brain and spinal cord, but you don't necessarily get the training on how to care for people who are living with the condition. So that's something here at SBA we're very passionate about advocating for and creating training programs so that we can train as many professionals as possible. Tim, do you have any thoughts on that, or what specialists you think are really important for adults?
I think particularly as you get older in adulthood, but even throughout adulthood, finding a good primary care provider. I will say that medical school and residency training for adult providers, unless they are physical medicine and rehabilitation specialists, many providers are not going to know much about spina bifida. And because I have worked in medicine, I and experienced training, although that was in the dark ages since I'm old and gray. But I have always viewed that I have a responsibility to find a primary care provider who listens to me and is interested in helping me with my issues and is willing to learn something about spina bifida. Um, because we know that medical school and residency training, people are not getting enough. And we're working on that issue and we're passionate about that at Spina Bifida. But I think adults with spina bifida need to know their bodies and be their own advocates and help provide their particularly primary care providers with understanding what are the issues they have, what issues occur in spina bifida, and finding someone that you can communicate with and who listens to you. So as I've looked for my own providers over the years, I learned that I have to advocate for myself. So I was less interested in knowing what they knew about spina bifida from the time I met them and more interested in were they willing to work with me to learn more about spina bifida so that they could see what issues I was having and what I might need help with and what referrals I might need. Um, so I believe a good primary care provider who does that is important. I think I think that a good urologist is important, and certainly in the world of urology, there are more and more people who are interested in longitudinal care of adults with spina bifida. They don't exist everywhere, but I think as a specialty that group is recognized that care for adults needs to happen. And so there are more and more providers that I think are doing that. Um, I think physical medicine and rehabilitation, because you need somebody who can evaluate what's happening with your mobility, who understands wheelchairs and bracing, uh, who knows how to help you access for resources if you develop a wound, who understands different pressure relief systems. I think that is very important as well. So I think um, I think that neurosurgical care is important, but in the world of adult neurosurgery, it's often again very specialized, and it's not often that you will find somebody who can provide you longitudinal follow-up in that area. So I think relying on a good physical medicine rehabilitation specialist who understands disabilities and a good primary care provider, and then knowing your body and what your body is telling you and what is different than it's been in the past.
Yeah, and obviously I'm biased being a PM&R physician, but that's something that I also feel strongly about that can be a very helpful addition to your care team. And at SBA, we're working on training more PM&R doctors to know about spina bifida. There are PM&R doctors who are trained to treat spinal cord injury. So even if you find, a PM&R doctor like that, it may be very useful to you. I'm going to jump to the last one on this slide next, which is mental health experts. And the ones that I think come to mind that are important for our population are counselors, psychologists and neuropsychologists, and psychiatrists. And I'm not sure that our population necessarily understands the difference between all of those. What are your thoughts on that, Tim?
I would agree that those people are important. I think counselors serve as a primary line. They are used to counseling while they may not have experience with spina bifida. They certainly have experience with depression and mental health. They potentially have experience in post-traumatic stress disorders, which is a very general term, but may also the topic of what we call medical traumatic stress has become important in spina bifida. That's the stress that happens because we have to do interventions, treatments, or surgeries for the management of the condition of spina bifida. And while those are important, they also can give psychological and emotional distress. And so I think counselors are very important. Psychologists can also be important. And neuropsychologists and psychologists may be able to assist with more specific planning. So if you're particularly struggling with an issue, what are potential strategies that you can do that may help alleviate depression or anxiety? What causes those in you, and what are strategies? Psychiatrists can be important, although I don't know in pediatrics, they are pretty focused now on medical treatment of depression and anxiety. They don't do much counseling per se. Um, so I think they are important. One of the, again, community research agenda topics is indeed mental health. And so they're thinking of a number of these questions as well, and how we go about researching those. I do think that many of the treatments that mental health counselors utilize are useful in people with spina bifida, but there may be differences in people with spina bifida in terms of how they perceive their conditions or how they can look at addressing them, which may require some specialized treatment. But that's, again, one of the outstanding questions that we don't have the answer to.
And I'll jump to the middle questions because I wanted to point out that I think the answer to these questions primarily are found in the healthcare guidelines. So as far as, advocating for yourself and the community by, teaching providers about what they need to know and directing them to resources, what you'll want to do is refer to the spina bifida guidelines. So there's a version that is online that is written for providers. And there are a lot of different sections that go over all the key things that folks need to know about how to care for this condition. And there are adult sections in all of the parts of the guidelines that you can look specifically what recommendations are there for adults. And there's also a version that's written in more layman's terms that you all can download also for your own reading and understanding. So I would say, you utilize both of those. Use the version that's written for you, for yourself, for your understanding, and then direct your healthcare providers to the guidelines so that they can learn as well. And we're going to put up a QR code on the next slide so that you can see how to get to the guidelines. The guidelines are available both on the website as a PDF, and there's also an app version. And we'll go to the next slide. So mobility, there's a question here about preserving joint function and potentially using a knee brace help. I will point out that there is a guideline specifically on this. We know that a lot of people wear ankle braces or AFOs, and sometimes that's enough and what all people need in order to be able to control their ankle. But a lot of people do have some problems with knees, and that can progress over time. And especially with a lot of limited mobility, can progress sometimes more quickly. And so there are considerations that in some folks using a knee brace early on can help, prevent the knee from developing progressive arthritis. So that's something you definitely want to talk with your physicians about to see if that's important for you. There's a lot of considerations when it comes to bracing. Does it fit well? Is it cumbersome? Will it cause skin breakdown? Will it be effective? So that's really a very individualized thing. But I think in some people, a knee brace can be helpful. We're not just correcting the problem today. We're also using bracing to prevent problems down the road. And that's what people sometimes don't realize. They'll say that, well, I can walk without my braces. Well, that might be true, but braces not only help you walk, they also keep your joints aligned to protect them from, ongoing damage. So it can be important to wear braces for prevention. There's other questions here about osteoarthritis as far as affecting the spine. And the answer to that is yes. People can get osteoarthritis in their spine. Anybody, regardless of whether you have spina bifida or not, can get different types of degenerative changes in the spine. Often we'll call this spinal stenosis, would be one term for one type of degenerative condition. And so I think what's really important here is to go to a provider who can understand the difference in what could be spina bifida related versus what could be aging related, because the treatment for those two things are very different. We want to be able to treat spina bifida related conditions like tethered cord by, pulling in experts like neurosurgeons, but treatment for osteoarthritis of the spine might involve different types of providers, orthopedics or PM&R or interventional spine or pain physicians. So the key here is diagnosing the problem, really determining where the problem is coming from, because that will lead you down the right treatment pathway. And we have some great resources for back pain in spina bifida, and that is available on the spina bifida website. This issue particularly can also affect people with spina bifida occulta. So it's something to keep in mind if you're having back pain. What about exercise and osteoarthritis? Tim, do you have any thoughts on that?
Um, I am not an expert in osteoarthritis and adult care, but I do know that from my physician and the exercise people that I am seeing that uh, exercise is important for osteoarthritis and helping to maintain mobility. Um, and so I do think it's an important component. Um, but I have no personal experience with that. Excuse me, no professional experience with that. I have personal experience with what is being recommended to me at this point in time since I have osteoarthritis. So
Yeah, I think whenever you have joint pain, you can have weakness and your joints can become stiff. So exercise can lessen those effects by keeping your muscles strong where possible and keeping your joint range of motion. So there are potential benefits there. And people have also asked about bone density testing. And one thing we should point out is that we actually have bone health guidelines now. That those are one of our newest sets of guidelines. And I know, Tim, you were involved in developing those.
so we do recommend that it's important in adults to do bone mineral density testing. Much of this literature is not based on spina bifida, but was based on spinal cord injury, because there has not been a lot of literature related to spina bifida itself. So we had to extrapolate. But there are recommendations in terms of who and when bone mineral testing should be done.
Yeah, the recommendations, even in people without spina bifida, can be pretty complex. They're based on age, they're based on risk factors. But even just having spina bifida and not having had a bone density test before might be a reason to talk to your doctor about it to see if they would want to order one for you. Another important question to ask when you get a bone density test is, what parts of the body will be tested? Because not all testing facilities can test all different parts of the body. And in some people with spinal cord injury, it's important to test parts of the leg, which all facilities don't necessarily have the capability of doing. Another issue that I see with some of my patients is accessibility of the testing sites. You have to be able to transfer onto a table in order to get the test done, and not all of those facilities are either accessible or have techs who are willing and able to get you into the right position to do the test. So that's the unfortunate reality, but it's really important, I think, to ask these questions before you go, just so that you're prepared with information and can talk to your doctor about which site can do a good test for you. And our final question relates to managing chronic pain. What are some considerations of chronic pain in aging individuals with spina bifida? Thoughts on that, Tim?
I think you touched on some of that earlier, which is pain can be chronic for a number of different reasons, some of which may be spina bifida related, some of which may be aging related, and it's important to differentiate between those. If you have physicians who are experienced in helping to diagnose exactly what's going on, then the more specific treatment for pain, maybe something like a spinal cord detethering or, something like that. Chronic pain for which a particular cause cannot be found or which has been difficult to manage, there are certainly pain specialists, but there are a number of different interventions that people can do now. And I know in the orthopedic world, there are advances, for example, so I'm going to get this wrong, and Brad, correct me because you know this better than I do. So you can do injections to help manage pain in the knees, for example. There are some new treatments that are involving some gels or other kinds of substances that can be injected that help promote lubrication that might have lessened due to osteoarthritis. So I think understanding and identifying the cause of pain can lead to a treatment. And then if those are not successful or may not medically be possible for a given reason, then there are people who are experienced at chronic pain. While those may involve medications, a lot of it involves mental health support, exercise, and people who understand exercise, for example, in aging or people with disabilities, identifying a community of people that helps socialization and contact. We know that how we think about the pain we have and how we approach living with it, that there are a variety of methods that can be helpful. So it's a difficult question to answer, but I think identifying the cause, identifying the appropriate treatment, and then if you're still left with chronic pain, seeing what other options you have. So.
Yeah, I totally agree with that. I was just going to say that, many of my patients have more than one type of pain, so the treatment can be very complex and not necessarily all from one pain generator. It might be, nervous system pain. It might be orthopedic pain. It might be abdominal pain. And those things require very different and sometimes combined treatments. And I think for that very reason, some of these, more comprehensive pain programs, like you mentioned, that involve pain psychology, that involve physical therapy, that involve occupational therapy, as well as pain specialists can be really beneficial for this population. I think we've run to the end of the questions, but I know there's a lot of questions in chat that we haven't gotten to. So we will definitely follow up with some with some answers offline to those other questions. And we really appreciate all of your attention, your excellent questions. With that, we're very thankful that you joined us tonight.
And thank you, Tim and Brad, for your wise information tonight. Thank you for all who stayed with us. And please complete your evaluation that you will receive so that we can learn what topics are of interest to you for the future. Good night, everyone.